Hi, and welcome to the CHNA 2026 survey training. My name is Annie Damude, and I'm joined by my colleague Jessica Francis. The objectives of today's training are to understand the purpose of the CHNA survey, become familiar with the tools and resources available, and also to review data collection guidelines. Some of the most important details about the survey is that it's open from February 2nd to April 30th. During this time, we want to encourage people to take the survey, to share the survey, and to explore past results. You can find this information and get started on our website, maricopahealthmatters.org. Before we dive in, let's get to know a little bit about Maricopa County. Maricopa County is the third largest health jurisdiction in the U.S. and the fourth most populous county, with 4.5 million residents accounting for 62% of Arizona's population. Maricopa County encompasses 27 cities and towns. 5% of the county is tribal land. It is essential to collect data that reflects this diversity when we conduct community health assessments. Diving into the purpose of the Community Health Needs Assessment, or CHNA survey, we'll see that the purpose of a CHA is to understand the health needs, strengths, and priorities of community members. Every 3 years, we conduct a CHNA by working with our community partners from start to finish, reaching out to residents to understand their health experiences through data collection, and creating data reports that healthcare partners and community-based organizations can use to make informed decisions on how to provide the resources and services their served communities need. CHNA results are used by healthcare systems to allocate community benefit funding. They're used by local nonprofits to apply for grant funding, and they're used by governments and organizations to set their priorities when developing services and programs. Working with community partners is at the heart of the CHNA process, which is why we're so excited to have you join our efforts. Our CHNA efforts are led by the Maricopa Health Matters Collective, a multi-sector partnership that helps to amplify voices and perspectives of those in diverse communities across the county. Over the last decade, the Maricopa Health Matters Collective has worked with community partners to increase not only CHNA participation, but increase diversity of participants that we reach out to. This last cycle, we focused on intentional recruitment across various populations. This led to a 27% increase in participation from 2021 to 2023. The community survey is only one part of the overall CHNA. Using the Mobilizing for Action through Planning and Partnership, or MAP 2.0 framework, we also collect focus group, key informant interviews, and secondary population data. All the data collected is used to identify the top health priorities that will be addressed by the Maricopa Health Matters Collective through a community health improvement plan. To support community partners and residents in taking action in their communities, the data is shared online at maricopahealthmatters.org in multiple formats, including a plain language CHA dashboard that ties all the data together, in-depth data reports for each data collection piece, as well as community profiles summarizing the top CHNA survey results for select areas and populations. With that brief overview, here's what you need to know to get involved this upcoming cycle. The survey will be available in both English and Spanish. It will be available in multiple formats, on paper, online, and via phone. Most participants should be able to finish the survey in 10 to 15 minutes, and it consists of 23 questions that cover self-reported physical and mental health, barriers to accessing healthcare, and general demographic information. Participants' answers are completely safe and secure, as we don't ask for their name or any other identifying information. While there are multiple ways to take the survey, we highly recommend offering it virtually first to reduce the number of paper surveys that need to be entered. This helps shorten the amount of time spent on data entry. Of course, if somebody needs to take the survey via paper format, that is absolutely an option. Anyone 13 or older living in Maricopa County can take the survey. We will be promoting the survey online and at public events, clinics, and any of our community partner events. The goal is to achieve a convenient sample that approximates county and region population distributions while meeting or exceeding recruitment targets for all specified subgroups. This goal can be met by having 15,000 participants in Maricopa County take the survey. The Maricopa Health Matters Collective will be working with community partners to collect about 1,250 surveys per week within the 12-week window to meet this goal. This slide shows the map of Maricopa County with the 5 public health regions: Northwest, Southwest, Central, Northeast, and Southeast. These regions were created in 2020 to understand the diversity and needs across urban, suburban, and rural communities. Because we use convenience sampling to reach out to people at community events, we need as much support as possible to share the survey across the entire county. This helps us move closer to the goal of achieving results that reflect the demographics of people who live in the county. There are many ways to support CHNA survey outreach. Starting February 2nd, you can take the survey yourself by visiting maricopahealthmatters.org. We encourage you to share the survey with your friends and family. There are more ideas for how you can share the survey with your network in the promotional toolkit on our website. Lastly, you or your organization can help collect surveys. You can attend a CHNA office hour or email the CHNA team at maricopahealthmatters@maricopa.gov to learn more about how your organization can participate in survey promotion and collection. With that, I'm going to transition to my colleague, Jessica Francis.
Now we'll be going over some guidelines and best practices. And please note, while we'll be going over some of the main ones, there will be documents available in the virtual toolkit for reference or for printing out to use at community events. So now we'll be going through the do's and don'ts of data collection best practices. In order to share the survey purpose and instructions, we do ask that you share at the beginning why the survey is important. Some examples include providing how organizations use the data to guide their resource allocation, to direct their funding, or to help identify the top health needs in their community. Do explain that the answers are anonymous and that the process of taking the survey is safe and secure. Do encourage the participants to complete all questions, but do state that they can skip questions or stop participating at any time. Thank the respondent for their time, regardless of if they took the survey or not. And when you receive the survey back, ensure that the zip code on the first page is filled out and completed. Don't ask for ID or documentation status. As a reminder, the only requirements for taking the survey is that the participant is 13 years or older or has been living in Maricopa County. In order to collect data responsibly, do ensure the participant's voluntary consent to participate, ensure respondent privacy and confidentiality, obtain parental or guardian verbal consent for minors between the ages of 13 and 17, store completed surveys in a location other than a patient's chart if you're a clinic, or in a secure folder. Give participants space as they answer or read through the responses. Don't require people to take the survey to receive services or necessities. Don't provide the survey in schools. Don't pressure the participants. And don't knock door to door to provide the survey. You can provide appropriate assistance by providing it if asked. Ensure that you handle sensitive topics professionally and without judgment. You can provide explanation about survey terms when needed, and keep a neutral tone and facial expressions when administering the survey, answering questions, and putting away the completed survey. When you do all this, you can ensure that you don't bias participant response or answer on behalf of the participant. When providing appropriate incentives, just keep in mind that incentive items are not required in order to help with promoting the survey. But if you do go down that route, you are encouraged to provide fun or useful items or low-cost items such as stickers, fidget toys, first aid kits, or concession stand tickets, for example. We discourage providing monetary incentives. In order to deliver paper surveys back to Maricopa County, we ask that you drop them off within 2 weeks of completion so that they are included within our survey monitoring. You can contact Maricopa Health Matters at maricopa.gov to schedule a survey drop-off appointment or connect with your MCDPH staff contact. So by visiting maricopahealthmatters.org, as a recap, you'll be able to explore past CHNA data to see what we've done in the past. You'll be able to sign up for the CHNA email listserv, where you will get regular updates, not just throughout the CHNA survey cycle, but even after the cycle once we've published our reports. You can register for CHNA promotion office hours in order to get more assistance from the team or ask any questions that you may have. And coming soon on February 2nd, you will be able to access the promotional toolkit, take the survey yourself, and reference our live FAQ that we will be updating on our website with questions that we receive from those who are helping us promoting the survey. Thank you.